Leslie Bradley with the Division of DD Federal Programs Unit, and just want to thank everybody for taking time to join us today. I know it's busy, it's almost the holidays, so we really appreciate you, and hoping we have a good presentation and we can answer some of your questions and feedback today. Before I get started, I'm going to let Kimberly Stock and Jennifer Bax introduce themselves as they are part of the DD Health Home team. I'm going to pass it to Kim first.
Thank you, Leslie. Good morning, everyone. My name is Kimberly Stock, and I am with the Division of Developmental Disabilities Quality Programs Unit, and I will pass it over to Jennifer for her introduction.
Good morning. I am Jennifer Bax, and I work here at the department. I am in the Medicaid and Reimbursements Unit.
Great. So we'll go ahead and get started. What we are presenting today is a proposed vision for the DD Health Home. The division is working with Missouri Department of Social Services, MoHealthNet Division, or Medicaid, to implement a DD Health Home. A DD Health Home will help coordinate care for individuals served through the division who have qualifying health risk and chronic health conditions. Before the DD Health Home can begin providing services statewide to individuals who qualify, approval must be given first by the Centers for Medicare and Medicaid Services, or CMS, through a state plan amendment, or SPA. The SPA is basically a CMS requirement that helps the division plan, implement, monitor, and conduct quality services through the DD Health Home. Let's talk about what a health home is and what it can do for individuals who are eligible for that program. A health home can help support individuals in managing chronic health conditions, medications, and medical treatments. It can assist individuals with meeting their healthcare goals and provide information about general wellness, healthy eating, or exercise. The health home team will partner with an individual's planning team to identify and address specific healthcare needs for that individual. And while it's important to understand what a health home is, it's equally important to understand what a health home is not. What a health home is not, it is not a home. It is not a place where you would go to live, and it does not change where you live. It is not direct medical services. It's not like your doctor's office or a hospital where you would receive medical treatment. It does not change an individual's planning team. It actually adds another partner if the individual so chooses. And if the individual makes the choice to participate in the DD Health Home, it will not affect an individual's current MoHealthNet or Medicaid benefits or services. A DD Health Home is an additional service option for Medicaid eligible individuals served through the division. This includes individuals in waiver services and individuals not receiving waiver services. With identified health risk and chronic health conditions, individuals can choose to participate in this service if they qualify, and we will get to DD Health Home eligibility requirements on the next slide. Individuals in the DD Health Home program will have access to a team of qualified healthcare professionals that promote wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home will support an individual's existing planning team. Individuals will be supported to identify their overall health outcomes, health risk, learn how to address their health risk, improve the management of their chronic health condition, and therefore improve their overall health and wellness. So keep in mind, all of this support will be driven by the individual and their identified healthcare goals. Providers will be DD targeted case management and accredited or certified DD home and community-based service waiver providers.
As Leslie mentioned, there is eligibility criteria for an individual to be able to access the MoDD Health Home services. And so again, the intent is to serve adults and youth with a developmental disability who are eligible for Division of DD services, who have had a health risk screening tool completed, and as a result of that screen, have a healthcare level of 3 or greater. Additional criteria for eligibility include having one or more of the following chronic health conditions. The chronic health conditions are to include diabetes, asthma, cardiovascular disease or hypertension, chronic obstructive pulmonary disease or COPD, overweight with a body mass index or BMI of greater than 25, condition of dementia, dependent on a ventilator, or one or more of the following conditions that would place the individual at risk of developing another chronic condition, such as pulmonary aspiration, bowel obstruction, gastroesophageal reflux disease or GERD, seizures, sepsis, dehydration, or tobacco use. Also within the Missouri DD Health Home eligibility criteria could be the diagnosis of someone being diagnosed on the autism spectrum disorder.
Individuals will be auto-enrolled in the DD Health program. When the DD Health Home is approved, individuals eligible will receive a letter notifying them of their provider's name and that they will be receiving a call from their provider. Individuals can request to change DD Health Home providers or stop receiving DD Health Home services altogether. There is no charge to individuals for this program, and participation in the program is not required. It is the individual's choice to participate. Participation in the DD Health Home program will not affect an individual's current Mo Health Net or Medicaid benefits or any other Medicaid service. Provider infrastructure. Providers will be enrolled statewide. The division will auto-assign individuals to providers within the division's 5 regions: Central Missouri, Kansas City, Poplar Bluff, St. Louis, and Springfield areas. If you are receiving waiver services or support coordination services from a provider who then decides to become a DD Health Home provider, you would be auto-enrolled with that same provider. There are 6 statutorily required health home services, which include those on the screen here. Comprehensive care management. This is the initial and ongoing assessment of an individual's healthcare needs and supporting an individual with development of healthcare goals to promote wellness and management of chronic health conditions. Care coordination will assist individuals with implementing and meeting their healthcare goals, monitoring progress towards these goals, and coordinating care with multiple providers. So this could include primary care, acute care, behavioral health, as well as long-term services and supports. Motion will be the education and engagement of an individual in making decisions that promote healthy lifestyles and improve overall quality of life for the individual. Comprehensive transitional care from inpatient to other settings is basically supporting the individual and their family or caregivers when the individual is transitioning between settings such as a hospital, nursing home, rehabilitation facility, community-based residential setting, or even back to their own home. This service can also be provided when an individual chooses to transition from the DD Health Home to a new health home provider. Individual and family support. This is coordination of information and services to support individuals and their family or caregivers to maintain and promote a healthy life with a focus on community living. And referral to community and social supports is providing information and referral to individuals and their family or caregivers on community resources, regardless of funding source, that can assist the individual healthcare goals.
Missouri will pay DD Health Homes the cost of staff primarily responsible for delivery of services not covered by other reimbursement, including the health home director, physician consultant / nurse practitioner, nurse care manager, specialized healthcare consultant, and the DD Health Home facilitator, whose duties are not otherwise reimbursable by Mo Health Net. The DD Health Home per member per month includes health home specific training, technical assistance, administration, and data analytics. All DD Health Home providers will receive the same per member per month rate. At the current time, this rate is still being developed, and we are hopeful to submit the state plan amendment by spring of next year. And at that time, the per member per month will be established.
As mentioned earlier, the DD Health Home team provides individuals with a team of qualified healthcare professionals that promote wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home team will include a health home director, nurse care manager, physician consultant or nurse practitioner, specialized healthcare consultant, and a DD Health Home facilitator. A specialized healthcare consultant will include one or more of the following: a behavioral health consultant, dietitian, occupational therapist, physical therapist, or speech language pathologist. Just to give you an idea of what these team members are responsible for, the DD Health Home Director is the champion for the Health Home program and will be integrating physical and behavioral health, prevention, and wellness while managing Health Home enrollments, discharges, and transfers, and overseeing the daily operations of the Health Home. The physician consultant or nurse practitioner. Now, please think of these differently than when you go to see your primary care doctor or your nurse practitioner that you would see for medical treatment or, say, an annual physical. These positions will stay very general and high level and establish organizational priorities for disease management and improving health status. They participate in case consultation with the interdisciplinary teams, help educate clinical and direct care staff on the nature, course, and treatment of chronic diseases, and develop collaborative relationships between the DD Health Home organization and the treating primary care physicians, primary care physicians and psychiatrists, and between the organization and other healthcare professionals and facilities. The nurse care manager is responsible for overseeing the health trends of the entire population of individuals in that DD Health Home program. They follow up on identified trends, participate in health education activities, including topics such as smoking cessation, disease prevention, and medication adherence, as well as completing medication reconciliations for health home individuals post-hospital discharge. The specialized healthcare consultant will focus on managing a population of individuals versus actually providing specialty care. Supports the care team and the individual in identifying and behaviorally intervening to improve and manage the individual's physical health condition, assist with medication adherence, treatment plan adherence, self-management support, and goal setting, and also can facilitate staff trainings. It also allows the DD Health Home to have the flexibility of offering additional consultation from a variety of healthcare professionals for special populations. And last, the DD Health Home facilitator will have a close understanding of their community that they serve and serve as a liaison or link between health and social services and the community to facilitate access to services and improve the quality and competence of service delivery. The DD Health facilitator tracks and facilitates individual enrollments, transfers, and discharges, schedules meetings and appointments, facilitates information exchange, tracks individuals' hospitalizations, discharges, and ER visits, tracks and facilitates health screening completions, supports information technology functions, and supports the general team operations for the DD Health Home. To quickly recap, the DD Health Home is not a physical home. It is a program that helps coordinate services and connects individuals to resources for their health care needs and goals, which helps them live healthier lives. And again, participation in the program is not required. It is voluntary. The proposed implementation date included in the state plan amendment is January 1st, 2024, with many, many development and implementation steps between now and that date that you see. If you would like more information on the DD Health Home or are interested in receiving coordination services through the DD Health Home once the program is implemented, or you're interested in becoming a DD Health Home provider, please email the division at ddhealthhome@dmh.mo.gov, or you can also visit the DD Health Home webpage, which is listed here on this slide. And as Kat said in the beginning when she introduced us, this is these questions and all this feedback is being collected, and we are working on a FAQ or question and answer document that we will be eventually posting on the DD Health Home webpage. So all of your questions and feedback are always appreciated. It does help our Division of DD small work group and team as we are developing and implementing and planning health homes. So please ask your questions, give us feedback at any time. You can email that email box at any time as well. And with that, I am going to turn it over for questions and answers and see if we have any. Kat, do we have any in the chat right now?
So far, I've only seen two. One question was about substance use. And that was towards the very beginning.
Thanks, Kat. This is Kim. On slide 4, we did outline the current eligibility criteria for the DD Health Home.
Okay. Our next question is, are these the only chronic health conditions that are qualifying? Could someone with some other condition qualify, like chronic hepatitis?
These are the current proposed qualifying conditions to meet eligibility for the Missouri DD Health Home at this time.
Will there be a manual detailing everything?
Yes, we are working on a operations manual for DD Health Home providers. And can we go back real quick to the substance use question? I know there was not a lot of detail in that question, but I did want to let the audience know that there are 2 other Missouri health homes at this time. There is a community mental health healthcare home, which is operated by the Division of Behavioral Health, which is our sister agency under Department of Mental Health. And there is also the primary care health home in Missouri. So if an individual comes to the DD Health Home and would better be served by one of these other 2 health homes, then we will work with the individual if they choose and feel like they would better be served under one of those health homes to get them referred to one of those health homes. So I'm not sure if that was the question, but I did want to give that information.
And Leslie, to add to that, that current division website that we have that speaks to the information pertaining to the Missouri DD Health Home also has information for the other 2 current Missouri health homes that Leslie just mentioned as well.
Yes, thank you, Kim. Let's see, will this PowerPoint be posted? Yes, we are recording today and we will be posting these webinars on the DD Health Home webpage.
I'm not seeing any other questions coming up at this moment.
Okay, we'll give it a few minutes, Kat, and just see. I'm not sure, Kat, can the audience raise their hands if they have a question? Do they have that capability?
Yes.
Okay, great. So if you do have a question and you don't want to put it in the chat, then you can always raise your hand and Kat can unmute you so you can ask your question to us. Okay, it looks like we do have another one. What does it mean to be a health home provider? Would you have to hire all of those positions that you listed under the positions? So yes, you would have to have these required provider positions on your healthcare home team. A specialized healthcare consultant, you may not need all of those positions that we discussed that could fall under that position. Individuals within your health home. And what it particularly means to be a health home provider, we are working on a designation process for TCMs and accredited or certified DD HCBS waiver providers to become designated as a DD health home provider. So that is still in development. There will be requirements and qualifications to do that. So please stay tuned for more information details on that. Oh, yes. Thanks, Kat, for putting that in the chat. So she put in the DD Health Home webpage and also the DD Health Home email box address.
Are individuals who receive ISD or community networking eligible for healthcare home? If so, should provider agencies participate in HIN such as LACIE, HIE?
So take the first part of this question, and Kim, I may need your help on the second part. So individuals who receive ISD or community networking would be eligible if they meet those requirements on slide 4 for the DD Health Home, because as we said, this will be for individuals in waiver services as well as individuals not in waiver services. This is a state plan service. And then I am not familiar with Lacey HIE. Is there any other team members, Kim or anyone?
This is Kim. I believe if I'm understanding the question correctly, they're asking if the agencies, a DD Health Home provider agencies to participate in a health information network. That currently is not a requirement for the proposed Missouri DD Health Home provider agencies, but we appreciate your question.
Thank you.
Did I read this correctly, that targeted case management service providers could become health home providers? Would this be the same counties they are providing targeted case management?
Yes, so that's a very good question. Yes, the proposed providers of this service are DD TCM providers as well as HCBS waiver providers who are accredited or certified. And we are still working out the details regarding the counties, but that is a possibility. As we said, if a TCM provider decides to become a provider in the county that they are providing TCM in, then individuals could potentially be enrolled with that same provider. So again, we are still working out the details on that, but that could be a possibility. Okay, and then there was clarification about the health information network associated with SetWorks. Thank you, Kelly.
I'm not seeing anything else popping up at the moment.
We'll give it a few minutes. Again, if you do want to ask a question, you can raise your hand and Kat can unmute you. Or you can drop it in the chat for us. These are great questions, and we always appreciate getting feedback. We appreciate the questions. It helps us think through the planning, the development. We take these back and we discuss them as a team. So really appreciate the thoughts and the great questions. We really do. Like I said, we're going to make sure that we get these included in the FAQ. Okay, Kat and team, I'm not seeing any more chats. Kat, did anything come to you by chance?
No, we haven't had any more.
Okay, then we're going to go ahead and end the webinar today, and just thank you all again for taking time and being with us. We are going to have one more of these tonight at 6 p.m. So if you know of anybody who would like to attend, please get the word to them. And we will be taking questions again at 6 o'clock. So thank you all very much and have a great day.